Is she ready?
Everything. I did. Okay, so did we introduce ourselves
I
and
could
say
bend
what we
my,
want her to do
I
and
could
give
bend to a certain
precautions?
degree. I just did like this. That's not bending.
Okay, time out. So here's our patient, therapist, right? So when I do this, I'm going to want you to walk in, say who you are, hi, my name is, and you know, I'm here, we're going to get dressed this morning, we're going to do lower body dressing. And I want you to say, I know you have a hip replacement of your right hip.
All that?
All that.
Let's take
We
this
know
out.
all that, right? We know all, those are all facts. Hip replacement of your right hip. Let me tell you what you cannot do, right? Because you have to give your precautions to her. So let me tell you what you cannot do, and then blah, blah, blah. And then give her the equipment to show her how to use it. Listen, for 15 points, you really got to work it.
Hi, Miss Gail. My name is Barbara. I'm your OT for today. I'm going to teach you how to dress your lower body part because you have hip replacement. I cannot.
I can hear you. Okay, go ahead.
Okay, what I want you to do is to keep your body position in 90 degrees. I don't want you to twist.
What's 90 degrees?
Right, the way that you are right now. I don't want you to
okay.
twist. I don't want you to put your leg. I don't want you to close your leg, and I don't want you to put your leg in or out, extension or
Rotation.
rotation.
Internal or external rotation.
Internal.
Rotate your hip. So if you want to say that in a simple way, you just want to say your toe always needs to face forward. No external rotation, no internal rotation. Okay?
Okay. And because you have your right side is the one that is affected, okay? I don't want you to like bend your knee or to put bare weight.
Well, she can bend her knee, because remember, the knee is okay. It's the hip.
She can
we're
bend
concerned with.
both-
She can do this.
Both of them?
She
I
can do
can
that.
do this.
Oh,
Yeah, and I remember when I
didn't
was
know
lifting, I
that.
could do
One
this.
thing she cannot do.
twist.
This.
It's
Oh,
this.
this.
No, you
Right.
do more than rotate. Bend past 90, whether the leg comes up to the body or the body bends down to the leg.
Right.
You can't
But
make
I
that
could do
angle
this.
smaller
She
than
can do
90.
this.
She can do that.
Right.
Mhm.
Oh, the body
Oh my
too?
God.
Here you go.
See, remember,
Yeah,
Gene
it's the
telling
same
me, no,
thing.
you can't do
can
that.
This way or this way.
So you cannot go like over your 90 degrees when you bending your knees. But I have to give. She have to do everything, right?
You're teaching her how to do everything. So those are her pants. And you're like, okay, here, you can use, here's the reacher, and you need to start by
Okay,
putting your
this is
pants
the
on the floor.
reachers. This is the pants. I have to throw it, or she have to throw it?
Yeah, tell her. You don't do it for her, you just tell her. I'm going to put these on the floor. Now I want you to use the reacher to put it over your whichever leg first.
I'm gonna put that on the floor. Okay. Use your reacher and. Why are you painting?
Wait a minute, what side did I get? What hip? What
Okay, you
hip?
have to start with your weak side. Okay. You have to
I
your
start
right
with my weak
side.
side?
Yes.
Okay.
You have to put it in your leg, your right leg first. Remember not to twist, not to bend, no rotation at all.
You can use your hand. This is easier.
Can she use her
Yeah,
other
you
hand?
can just you can use your other arm now. When you put it like right here, you can use your other arm. and
Oh,
put it
okay. But I have to get my other leg in first?
up. I'm sorry.
Do I have to put your other leg in first, right?
Now, you need to put it all the way in before you do that. First one is all the way in.
Yeah, all the way in.
And then you pull up.
Because now it's gonna be more difficult for you.
And if
you
she just
use
had
that-
surgery for a hip replacement, is she going to be able to sit like that with
No.
both her feet off the floor?
You
Oh.
You have to. That's why I told you to put that first. You put it up with this hand.
Oh, okay.
And then you can set up your. No,
But I can't reach it yet.
Exactly. So, because you put that leg inside. Okay. Okay.
Take that leg out.
But you see how we get
I don't want
frustrated
to
with our
start
patients?
over.
You see?
I don't want to start over.
But you gotta put this leg in first.
You bending.
Am I bending? Am I? Am I bending?
That's it, but
Now,
you put your
this is-
feet in the floor now.
Don't.
Okay.
Okay.
Don't give me that face, Barbara.
She's too much.
Are you in a nursing home?
I know.
Are you in a nursing home? This is not.
No, but now you can use
You're
your
good.
hands. If you pull it up against your knee,
good.
Yeah, that,
then there you go. And now you
okay, now you're gonna use this walker
Mm-hmm.
without twisting your waist. You're gonna use this arm and you're gonna pull it here for you. Okay? Wait, don't get it so you see. Don't do this
okay.
up.
Okay.
Okay, and now you're gonna with your two hands, you're gonna push yourself. You're gonna be straight, push yourself. You're gonna push all the weight in this leg, and you're gonna push.
On my left leg?
Yes, in your left leg, and hold yourself.
She bends.
She bends.
I bend?
Yeah.
Go.
Sit back.
Sit down.
You done broke your hip again.
You know what I'm gonna do? Put your feet on top of mine.
Okay.
Okay? Now do it again. You push yourself. You're putting too much weight in that side.
Okay.
You're putting too much weight. Okay.
Hey, doing this is hard.
You're doing wrong. Go back.
Okay.
Bending.
You cannot bend. You push yourself like this.
Okay. But I can't push your feet under mine.
It is.
Don't
very-
worry.
It's very low.
Barbara, it's okay.
Just a little. Yeah, it is low, but you really have to use your left leg. I mean, that is a reality. That you really have to push.
Wow.
Yeah.
Yep.
You're not used to this.
Yeah, I know. Still putting weight.
Okay.
Okay, you see what happened?
See what happened? How long in my pants? Oh my God.
You're supposed to bring your hands right here.
You could have given her her reach out.
Put your hand.
Because when you put your pants, you have to. When you put your pants here, you have to put it all the way here.
Oh,
Okay.
okay.
Try to stop it here.
Halfway
And
to
then
her
you
tie.
put yourself up.
I know.
Okay, so from that position, stand.
You see now?
Lift up.
I could use both hands.
Yes.
I'm not paralyzed.
Not paralyzed.
No, but you can't full weight bear on your right leg.
Exactly.
Oh, okay.
You're supposed to put your weight on your.
Okay, so let's give some feedback on what we've seen so far.
Why did I volunteer for this?
No, this is important because there's a lot of steps to this
Yeah.
task. It
Yeah.
doesn't look like it, but there's
It
a
looks
lot
easy, but
of
it's
steps.
not.
And each one needs to be accurate. So what did we see that could be safety hazards, positioning? What did we see? Go ahead.
Put your
Sorry.
both
Feet.
feet all the way through the hole.
Huge, huge. Make sure, therapists
Both
make sure both feet are through the legs completely before she stands.
Okay.
Because especially those are fleece. She stood up on her pants. That's, ooh, yeah, big time. Okay, what else?
You move towards you.
Yes, move toward the edge of the mat, big time. Because the more she moves toward the edge of the mat, so if my right hip is affected, I always keep that toe out and extended when I stand. You tell your patient, extend your leg, so that way you prevent them from putting so much weight. But the farther I am on the edge, I can bring my left leg in
And
close
give you more.
so that I can
Oh,
activate those
that's
muscles
why.
much
That's
easier.
why I
because
was
if I'm
hard
way
to
back
get
here,
getting up.
if I'm way back here, I have to
Yeah.
bend forward, right? So if I'm sitting on the edge,
Yeah.
I can stand up better.
I'm trying not to stand.
Okay, so those are the things I'm looking for. I'm looking for foot placement, I'm looking for body mechanics, I'm looking for hip precautions to be maintained, I'm looking for how you tell your patient to use the equipment. I'm looking to make sure, Lorraine actually moved her shoes out of the way, I expect the therapist to do that.
Safety,
to see
safety.
that- Yep, absolutely. Use of the walker, pushing up from the mat, all those things.
But
Okay?
can't you help your patient stand up?
If
Not
you're
supposed
weak,
If you're, yes, you
Yes.
can, but you're not at that level, you're a minicist.
Oh,
You're a
You already
minicist
passed
with
that
partial
level.
weight bearing, that's
Oh,
right, you're
okay.
past that. Because otherwise it would be more
move.
steps.
Oh, okay.
Okay. So, okay, so everybody got a good, now do your sock. Tell her how to do her sock. And the sock obviously has to be put on the right foot, the affected leg.
Okay, y'all. Now we're gonna put on the socks. We're gonna put this socks inside here, okay? Because I think when all these teaching, they do it themselves.
That's
too.
right, we do it, we show,
Oh,
and then we
because
take it
I
off
know,
and have
you
them
know.
do it.
Okay? You put it here, and then you're gonna put in your right size. That's your weak size first. So you're gonna, thank you. You're gonna be sitting straight, like I told you before. You cannot bend, twist, and do any kind of rotation. You just basically throw this on the floor and tuck it in. And you pull this up, and that's it. And because I can just move a little bit,
Yeah, I don't know why that has one rope instead of two. Cut it.
Okay.
okay?
Good.
You see her cheese?
You see, the patience we have.
This fish.
How was that? It was good, right?
Yeah.
That was good. Yep, excellent. Okay, 2 people for the CVA.